Hi, so my name is Amani Smith, and my health profession presentation will be on a physician assistant. So, before I get started on what is a physician assistant, what do they do, all those type of questions, I want to start off by saying, like, where did it all start? As you can see, this is an old picture, a very old picture. This picture was taken around the 1960s. And this man here in the white coat is a physician named Eugene Steed. He is the man who created the physician assistant career and very much expanded, I feel, as that health career. Um, he In the 1960s, there was a huge shortage of primary care physicians, and the way he fixed this was putting together the first ever PA class at Duke University in 1965. If you can see on the left of him, there's a woman, and that is a physician assistant, and you can tell she's also treating and diagnosing this patient. So there's two of them, and you can tell Eugene is more of the guy in charge. He's the supervisor. He's the one who sets stones the rules and what will happen, and the physician assistant is there assisting him in this process. So what is a physician assistant? So physician assistants are licensed clinicians who practice medicine in every specialty and setting. So they examine, diagnose, and treat patients, and they have that direct contact with their patients. As you can, you can see here, this woman is helping and having that direct contact with this young girl, helping her diagnose, maybe even finding a treatment plan for this young lady. So that makes what is the role of a PA? What can they do? In that picture there, what could she have been doing? So PAs can order and interpret test results. They can work in clinical research. They can take medical histories, do physical exams to diagnose and treat illnesses, perform procedures and assist in surgeries. They can prescribe medication, and they also can develop treatment plans for their patients. So then, if you read this list of what PAs can attain, it's kind of what is the difference between a doctor or physician versus a physician assistant? So physician assistants do all of their work under the supervision of a physician, and this makes it what's the difference, right? So PAs actually have more open schedules, and they have more time in their cases and with their patients, rather than if you notice a physician, they have so many patients to go to, especially when you go to the doctors. You always have that same doctor. They need help, you know what I mean? They need help in their job and some assistant to help them out, and so they're not because of their busy packed schedule they already have. So the cool thing about a physician assistant is they have that more time with their patients. They can bond more with their patients and know their patients on a regular, depending on the facility or specialty they work in. What's pretty cool about the PA also is they're able to switch their specialty, so they don't have to stay in one place. You know what I mean? They can switch to do anything, or even too, what's so cool is they can also work at two different facilities or two different specialties at one time, so not just staying and putting their eggs in one basket, but staying at one place. They can be diverse with their career. One thing that stood out to me is they're able to assist in surgery. So rather than versus a doctor or physician, they actually can do surgeries independently. So they can have their team, they can make their team, but they can do it independently. So they can run the whole show rather than physician assistant. They only can help, they assist. So if that's a clear thing, what PAs versus doctors are, those are a couple things that I put down. So here are different specialties of what a PA can do, or what type of place they can work at. So they can do dermatology, they can work on emergency medicine, OBGYN, radiology, anesthesia, neurology, cardiology, and like they can also even do orthopedic. It's like so diverse what they can do. They can do so many different things, which is like the best part about PA. Yeah, so what type of facilities can you see them in? If you ever even went to urgent care, you probably didn't even notice like you're working like a PA was treating you and diagnosing you with whatever problem you went to them for. They also are at hospitals, physician offices, health clinics, surgery centers. There's so many more places that you can find a PA. It's very, very cool. So PAs are actually in high demand for the healthcare, and their rank is very, very cool. They're actually the second best in healthcare, and they're ranked number 30 in best jobs overall. So that's like worldwide. um, the reason of the high demand is because of the shortages of healthcare workers, such as like doctors and nurses shortages, or like retirement, and especially the biggest thing, especially right now. In this time is because we had the huge COVID impacted the healthcare system a lot. Um, like right here, as I put, pandemic support, increase of patients. Like patients, there's so many patients, and there's not as many doctors as patients. So like the PA really comes in handy. They really come in handy for the healthcare to really help out, which is great. So their salary. So physician assistants makes around like 90K to 150K per year. So this does depend on the specialty or facility like physician assistant works in. Also, another thing that like plays a part of this is like how many years have they how much experience have they had? Have they worked for have this is their first year coming in, or is this their fifth year as a physician assistant? And what type of education do they have? Certification, skills. This is all plays a part into the salary. So it like depends on all these type of different factors of your salary. So education needed to become a PA. Majority of the physician assistant programs require like 3 to 4 years of undergrad. Sorry, and this could be like in health sciences. You do health sciences, you have to have like that major in science, so that bachelor's in science. So you can get into the health science program to transfer over to the PA for your graduate. You do PA program. That's like a main one. So the prereqs you need for the physician assistant program is like anatomy, biochem, physiology, biology, genetics, stats, English, chemistry. There's so many. It depends on actually what the PA program you're trying to attend. So some places require less, some places require more, some places, it's different. Also, depending on the PA program you want to attend, usually varies around like 500 to 1,000 hours of either like shadowing or healthcare experience, which is like even like a CNA, or like working with like the ambulance, the EMT, and like even like working with like kids at a camp, that some that are mentally challenged or things like that. That all is really good for to that works with that 500 to 1,000 hours of like that healthcare experience. So what do you even do when you attend a PA program? So you do like clinical rotations, like classroom lecture instructions. There's a lot of clinical rotations, and once you're finished, you would take a PANCE exam. So the PA program like varies sometimes like about 2 years graduate school, and then you would take that PANCE exam, which needs to be taken every 10 years. And that's once you pass that PANCE exam, you're licensed to become a physician assistant, which is physician assistant, which is like pretty cool. So my interest, I find being a physician assistant very interesting because they get more time, like, to focus on their cases and patients because of the workload being smaller than a MD, which I really find I really find working and like getting to know my patient and showing my patient that I really, really care for them and care for their health is a huge importance to me. Um, like just showing that more value and more time, like that really shows your patients you care for their health. Not saying that physicians don't, but they have that busier workload than a physician assistant, and sometimes don't really get to show that amount of care they have for their patient's health, which I find, for me especially, I find that playing a huge role into why I want to be a physician assistant. Also being able to like switch specialties. Like I said, like going into like dermatology, I don't have to just work at being a dermatologist. I can also do like working into like anesthesia or assisting in different like I don't have to stay at one facility. I can work either at one or two places at a different time, or I can go to one specialty to work at another. So it's all like it varies, whatever you want to do, whatever you're good at. And yeah, so also even being able to practice medicine in healthcare, um, even like working with like OBGYN or at the emergency room, like all at once. Sorry, I'm like everywhere. So PA as my selection. So um, I selected my presentation um, to be an physician assistant because I always found that the healthcare profession to be very unique. Like health in general is like a huge importance in the world. Like this is why we have so many people. Why like it all creates a huge unit. That's what makes it so unique. Like there's so many different things in people's health and how all different healthcares. Like we have so much healthcare that there's so many things of how we can study the human health. Um, with Peace having so many options, like I said, I love this, like how there's so many different specialties. I could interact with different people and different situations of human health, which I find very, very important. And again, so yeah, I have like even going to urgent care so many times, or like going to the dermatologist or anything like that. Um, I have always like had a great experience, especially with my with the physician assistant, rather than like when I go to the primary care doctors. Like sometimes I'm like with a different one, which just like as you go to urgent care, you have a different physician or physician assistant, things like that. But I always felt as the physician assistant always showed more care for me, and provided better like options or a treatment plan for me. I just always loved how they um, showed their care towards me, especially, and like towards their patients in general. They don't act as like they want to move on to the next, or um, they're too busy for my health, which I especially love. So, for any more, or if you want to look into the PA program or PA career even more, sorry, I have linked some websites here for more information on the physician assistant career. We have APA.org, bliss.gov, explore healthcare career.org. There's so many here that you can check out, which is pretty to have that wider aspect of the information for the PA program and PA career, like I said. And my references, and then that's basically, I'm going to wrap it up.